President of the Portuguese Republic, Professor Cavaco Silva, Chair of the jury, Professor Al Sommer, President of the Champalimaud Foundation, Maria Leonor Beleza, distinguished guests, and all of us who share a love for Mozambique, I am thrilled to be here today. I received news of this prize a short while ago, and I feel like I've been living in a dream ever since. I want to begin with a quote from our founder, Helen Keller. "The world is moved not only by the mighty shoves of the heroes, but also by the aggregate of the tiny pushes of each honest worker." Helen Keller International would not be receiving this magnificent prize today if not for the thousands of honest workers around the world who make our work possible, from village health volunteers and community drug distributors to district health managers and health ministry officials and dedicated HKI staff throughout the world. It is all of them who deserve this award. HKI has a very rich history. We were founded in Paris nearly a century ago to aid soldiers who were blinded in World War I. But over time, we switched our focus to the prevention of blindness, since there are so many blinding conditions that are preventable and treatable. In fact, we have the know-how to prevent and treat 80% of all blindness. This means that 4 out of 5 people in the world who are blind today did not have to go blind. That's what keeps HKI going. I've had the extreme privilege of traveling all over the world with HKI to see the miracle of sight being restored. I witnessed a mother in China having cataract surgery and seeing her child for the first time in 8 years. When she went blind, he was a boy. When the bandages were removed and she saw him, he was a handsome teenager with a small beard beginning. I've also seen the powerful benefits of sight being saved. I met a 10-year-old schoolgirl in Mozambique, and she's now worrying about how well she can do in school rather than worrying about will she go blind from trachoma. Loss of sight is a tragedy for anyone, but it is especially tragic for a child at the beginning of their life. Even more so when it could have been prevented, which is so often the case with vitamin A deficiency, which is the #1 cause of preventable blindness in children. I visited a school for the blind in Sierra Leone in West Africa a few months ago, full of beautiful, enthusiastic, hardworking students who were there studying for their exams. 80% of these children lost their sight following measles. If they had had enough vitamin A, they would be able to see today. Yet we know these are the lucky ones. Most children who've lost their vision to measles die within 1 year. And that's because if the vitamin A deficiency was severe enough for them to lose their sight, it means it was severe enough to weaken their immune systems so that they could not fight off common illnesses such as diarrhea, measles, and pneumonia. These diseases should never be fatal. Many years after HKI began our primary focus on nutritional blindness in children, as Professor Sommer mentioned, the link between vitamin A deficiency and childhood blindness was definitively proven, using our programs as a basis for the research. But even more startling was the groundbreaking discovery during these studies that vitamin A deficiency not only leads to blindness, but it also significantly increases child mortality. With this discovery in the late 70s, vitamin A deficiency became recognized as a global health problem, and as you've heard, one with a very inexpensive solution. 2 cents a capsule twice a year. And even if you lump into that figure all of the costs of delivering the vitamin A capsules, the training, the teaching manuals, the administrative staff costs, it is no more than $1 per year per child to save their sight and save their lives. Vitamin A supplementation is now a central pillar in the global fight against childhood blindness and child mortality, and it's been at the forefront of Helen Keller International's work ever since. As you've heard, our approach is to work through partners and to build their capacity. We work to strengthen local governments and community organizations to ensure that they have a long-term commitment to vitamin A supplementation and that the efforts can be scaled up. We integrate the vitamin A supplementation programs into their existing delivery mechanisms. So if a country already has national immunization days, they can add the vitamin A supplementation program onto the immunization day. Where delivery platforms like that don't exist, we work with partners to create new platforms, such as Child Health Days or National Nutrition Weeks. Nearly 90 million children received vitamin A in the past year thanks to the efforts of Helen Keller International and our partners. 180 million capsules in the past year alone. As you've seen in the film, we've gone beyond supplementation and worked to make vitamin A part of the daily diet without being reliant on a pill. We've set up community-based programs that teach local villagers how to grow fruits and vegetables that are high in vitamin A and other vitamins and minerals. And as you've seen, we've worked to increase the production and the consumption of orange flesh sweet potato. What we learned is that in Africa, sweet potatoes have white flesh, whereas in my country, they have orange flesh. And it is the orange flesh fruits and vegetables like carrots, papaya, mangoes that are very high in vitamin A. Through our partnership with the International Potato Center, we have worked with a new variety of potato, and just one potato that's about this big provides twice the daily recommended amount of vitamin A for a child. Of course, vitamin A is not all that HKI does, but our experience in vitamin A is what taught us how to work with governments and communities to help create and strengthen all kinds of health systems. We develop pilot programs to test new community models to prevent blindness from a range of causes. Once we know a model is successful, we work in partnership with government agencies, district health centers, local organizations to integrate the program into the ongoing provision of health care in their country, and then to take it to full scale so that millions of people are reached. We work to prevent the blinding diseases of river blindness and trachoma by mobilizing tens and thousands of community volunteers to distribute sight-saving medication. We've developed a comprehensive cataract care model that ensures that cataract surgery is not only high-quality surgery, but that it is affordable and accessible to the people who are hardest to reach. We've developed a successful model to correct refractive errors among poor school children who may be losing their chance for an education simply because they can't read the blackboard because they don't have glasses. Because of the way we work, as a catalyst, as a trainer, our work has a great multiplier effect. This means that the Champalimaud Award is going to make a huge difference for our ultimate beneficiaries, those who are the most vulnerable and disadvantaged. Everyone has been asking me, so what are you going to do with the prize funds? Well, we have a lot of ideas. In the beginning, we want to invest some for immediate impact. We want to use this as a call to arms to reach the hardest to reach children with vitamin A supplements, the last 10% or 20% of the target population that are currently being missed by the strategies that exist. And those are the kids who are usually the most vulnerable. Children who are 6 to 11 months old, so they're not yet in the health system. Children who live in the most remote rural areas. Children who live in crowded urban slums. Children who are part of marginalized populations. The Champalimaud Award will allow us to design and test strategies to reach these children who have been overlooked for too long. We can also take immediate advantage of the community volunteer networks that we've helped set up and add on additional interventions. So the community volunteers who are already in place to distribute ivermectin to prevent river blindness will also be trained to deliver vitamin A supplements. They can also be trained to screen people for cataract. So this award will allow us to deepen our services and broaden our reach, but with very big bang for the buck. We plan to make one very special investment in Mozambique, which is a key country for us. We want to use some of the funds as seed money to scale up our work with the orange flesh sweet potato so that everyone in Mozambique can enjoy the nutritional and health benefits from this remarkable and delicious potato. We'll also use some of the funds to enhance our ability to continue to innovate and to find cost-effective and sustainable solutions. The Champalimaud Award will allow us to attract high-caliber program professionals in Asia and in Africa to improve our program design and our evaluation so that the successes of HKI's programs can be documented and therefore they can be scaled up to reach many more millions who are still unreached. It will also allow us to provide more training to our current staff, including courses at one of our very favorite organizations, the Aravind Eye Care System, which was the first recipient of the Champalimaud Prize. And it will allow us to test new community and school-based strategies on a small scale and refine them before we seek larger funding. Finally, this amazing, amazing Champalimaud Prize will help secure our future by allowing us to make shrewd investments in our infrastructure and in our ability to raise unrestricted funds, both of which are critical to our continuing ability to innovate and to be there for the many, many millions of children who need us. I bring you back to the quote at the end of the film from Helen Keller, "Alone we can do so little. Together we are going to do so much." Thank you so very much.